Well, good afternoon, everyone. As you can tell, the sun comes out for important occasions. Well, welcome to Fairleigh Dickinson, to all of our guests from Medco and friends and alumni and certainly faculty and staff. It's so great to see everyone today. I'm Rick Reese, the Senior Vice President for University Advancement, and I do want to welcome you to this wonderful occasion for the university. You know, every now and then we have an opportunity as a community to come together, and this is one of a few instances in the past few years when we've been able to do this. In the past, we've come together for the announcement of Petrocelli College, and Ann Petrocelli is here. Thank you so much. And also in the past, the Stratus Arena a few years ago. And Mary Kay Stratus is here, 2 university trustees. So we're so glad you could be here. And just also we have Winston Lowe who's with us today, who is also a university trustee. So with that said, I know you're not really interested in what I have to say. There are others far more important than I, but this is a terrific day. We're so excited that all of you could be here, and without any further ado, it's really my pleasure and my honor to introduce the president of Fairleigh Dickinson University, Michael Adams.
Thank you, Rick. Good afternoon. Every now and then, we have the great good fortune to come together to celebrate something special. And other days, we're privileged to come together to be part of history. Today is both special and historic. Today we celebrate a new friend, a new partner, and a new act of philanthropy. Today we mark the official birth of an incredible and innovative program. Benjamin Franklin, one of my heroes, said, "It's easy to see, but it's hard to foresee." 3 years ago, we saw a school of pharmacy at Fairleigh Dickinson University that would stand out among its peers. Looking into the future, we were determined to create a school of pharmacy unlike any other in the country. That determination, coupled with strong leadership and the creative and gifted minds of faculty and staff, led to the development of a new 21st century pharmacy curriculum. Once that was in place, the New Jersey President's Council of the Commission of Higher Education approved our application to create the state's second School of Pharmacy. By the way, the last time a School of Pharmacy opened in New Jersey was 1892. So I think the state was ready for another school. Today, we acknowledge, we recognize, and say thank you to Medco Health Solutions and its chairman and CEO, David Snow. David Snow and his colleagues at Medco are donating $5 million to the university to ensure that our School of Pharmacy and its graduates will meet the growing and changing demands in education and in the practice of pharmacy. To honor that generosity, from this day forward, it will be known as the Medco School of Pharmacy. I would like to especially applaud the extraordinary work of 2 individuals. The first is the founding dean of the Medco School of Pharmacy, Ruth Neumeier, who joined us just in November. Her vision, her energy, and relentless enthusiasm took her to the doorstep of her colleague and friend, Russ Teagarten, Medco's Vice President for Scientific Affairs. Together, they saw the opportunity to create something fresh, relevant, and important. Russ took that idea back to his colleagues at Medco, who realized that the vision of this university aligned with their own. Consider these few lines from the Medco's vision statement. "We're a company that never stops trying to do it better. At Medco, good was never been good enough. We've always been at the forefront of the industry in knowledge, innovation, technology, and in pioneering new products and services. My friends at FDU, that sounds like us, doesn't it? It is. Thank you, Russ. Thank you, Ruth. But there are many others who deserve applause. The creative idea of a school of pharmacy was first suggested by Dwight Davidson, Assistant Dean of Students for Judicial Affairs at the College of Florham. That sparked interest and enthusiasm, and others stepped forward in major leadership roles, especially Mike Alvatroni, our new Associate Dean of the school, and Jeff Wyman, Dean of Benton College, both of whom worked hundreds and hundreds of hours in exploration, outreach, design, and development. We're grateful to them and to all those whose efforts have contributed to making this wonderful initiative possible. I'd also like to recognize the presence today of New Jersey State Senator Anthony Bucco from the 25th District, a longtime friend and advocate of the university. And it's always uplifting to have the support of our publicly elected officials. Senator, thank you for joining us today. Like Medco, FDU prides itself on being an institution of innovators and leaders with a global perspective. Just as Medco reaches out to populations for whom easy access to medication is difficult, so too does FDU reach out to often underserved populations. Consider, for example, our Puerto El Futuro program, Gateway to the Future, in which we provide a college education to new immigrants with limited English language skills. Consider our well-recognized online programs reaching special populations like members of the National Guard stationed in Iraq and around the world. Consider our community college partnerships and our more than 1,000 international students from over 60 countries. Our global reach dates back to our founder, Peter Sammartino, who established close ties with the United Nations almost from its very beginning, and who helped us become the first American university to own its own overseas campus, and who created the International Association of University Presidents, the largest organization of higher ed CEOs in the world. Those of you who know me know that I often say, it's a great time to be at FDU. Following faithfully that vision of Peter Sammartino, we are a university that dreams big. We are a university that aspires to make a difference in the world. With Medco at our side, our dreams and aspirations are boundless. This is a great day. Thank you to Medco, and thank you to everyone who has helped make this day possible. It now gives me great pleasure to introduce David Snow, Chairman and CEO, Medco Health Systems.
Thank you very much, Dr. Adams, and good afternoon to all of you. Thanks for joining us today. I'm excited to be here. I'm thrilled that Medco is able to help Fairleigh Dickinson create the new School of Pharmacy. Many of you in this audience might say, well, who is Medco? Why is Medco doing this? And why Fairleigh Dickinson? So I thought I might try to address all three questions so you'll understand why we're so excited. Medco and its leadership are fundamentally passionate about reforming healthcare. Healthcare reform is a noble cause. Delivering better healthcare, better outcomes at lower cost is something that benefits all. And it's something that we've recently gotten Fortune magazine recognition around as a most admired company when it comes to innovation clinically. We are a $66 billion company. Fortune 35 company. We have 25,000 employees today. Over 3,000 of them are pharmacists. At Medco, over 700 pharmacists are in leadership positions across the country and overseas working for Medco. We are doing things differently. We believe the practice of pharmacy is going to change dramatically. We think that healthcare reform is going to drive a need for more pharmacists and a differently trained pharmacist. And we hope, together with Fairleigh Dickinson, to meet that need with a special breed of pharmacist. So what do we need? Let me just start by saying that pharmaceuticals are fundamentally important relative to the delivery of health care. So just let me give you some statistics. Right now today, in this country alone, 50% of the entire population has chronic or complex disease. Of that population, that 50% spends 96% of all of the drug money. They spend 75% of all of the medical money. And for almost 90% of all chronic and complex diseases, drugs are the first line of defense once you have the disease to stay stable and out of the emergency room and out of the hospital. The real sad part of the story is that patients stop doing what their doctor tells them to do. 65% stop within 12 months. So we're spending the money on the drugs. The patients are still going to the emergency room, still going to the hospital, having the very negative outcomes associated with unmanaged chronic or complex disease. Take diabetes as an example. I think we all know what happens to a person with diabetes who doesn't manage that disease well. It's devastating at a personal level, and it's devastating at a national level when you don't manage that disease properly. So what has Medco done uniquely? Pharmacy is wired in this country. It's the only part of healthcare today that's actually wired end to end. And we actually have taken that fact, and that information comes to Medco. We can see real time whether a patient is compliant with what the doc told them to do. We bump that patient's progress up against evidence-based protocols that we use to define what we call gaps in care. So a patient who's non-compliant, we can see it, we can do something about it for the 66 million people we serve. And we can make sure they have a better outcome at lower cost by managing that care with that patient with our pharmacists. Another important fact to know, 33% of the time physicians are not following current evidence-based protocols because the knowledge domains in medicine are growing so deep, so fast, they can't keep up. So we can also see when a physician isn't practicing to current protocol, which is why, by the way, we spend another $200 billion on medical malpractice, is because from the time evidence is produced in this country today, it takes 17 years before it becomes standard of practice in medicine. That 17-year gap of time is a field day for malpractice attorneys. So if you think about the money we throw away tied to the poor management of chronic and complex disease each and every year, it's $350 billion. If you think about the money we throw away in this country around medical malpractice, it's another $200 billion. So if we want to make a real difference, pharmacists can play an enormous role. If they are clinically trained, we train our pharmacists deeply. So at Medco, we have over 5 million complex diabetics. We have over 10 million patients with cardiovascular disease. We have the volume and the scale to actually manage care deeply to drive a better outcome. And those pharmacists who are deeply trained can have a conversation with a physician that a generalist cannot have. And so our pharmacists, by the way, spend all their time cognitively using their training to deal with patients to drive a better outcome. They're not putting pills in bottles because Medco invented technologies and robotics where it's Six Sigma, error-free dispensing of pills after the cognitive work is done by a pharmacist. So Medco envisions a day when pharmacists are more widely considered part of the care team. There's going to be a shortage of physicians as healthcare reform gets implemented. Nurses and pharmacists and other professionals around that physician are going to be part of the care team. We need more of them to drive a better outcome in an accountable care world. We need pharmacists who want to spend time talking to patients. Many pharmacists coming out of medical school today want to work behind the counter and put those pills in the bottle and maybe talk to the physician, but they don't want to counsel patients. That's not really what they went to pharmacy school to do. We want to change that. We also want to have pharmacists who know how to lead others and do things in big scale. I'll just give you one more example. At Medco, we put out 100 million prescriptions a year out of our automated dispensing pharmacies. We can put out over 50,000 prescriptions in an hour using our automated technologies. A retail pharmacy puts out 48,000 a year. And we do it with 23 times more accuracy than a human can do it in a retail store. I need pharmacists who can understand scale to that level and manage lots of people to reform healthcare. I'm looking forward to doing this with Fairleigh Dickinson. I think we are going to create a new breed of pharmacists that will be very exciting, and I think we can change the world. So with that, Dr. Niemeyer, I'd love to have you come up here, and thank you very much.
Wow. Welcome, everyone. I'm so thrilled to see you here, and I'd like to thank whoever it was that's responsible for the weather. Most of us in this room at some point in our life either have or will walk across a stage to receive a diploma that comes at the culmination of a lot of hard work, study. And when we walk across that stage, there's cheers from family. Yahoo! Absolutely. There are these thoughts that we have about the realization that we've done all this hard work, we're finally done. Yahoo! There's also a feeling of anticipation of change. There's a lot of hope. There's a sense of adventure. And there's the realization that now's our time to change the world. Today, we stand here together celebrating the potential for ideas and adventures and our time to change the world. I'm honored to be the founding dean for the Medco School of Pharmacy. The opportunities, as I knock the microphone over, the opportunities to lead professional education and to lead change in the practice, to lead change in healthcare are so exciting. The expected outcomes of these changes, you've already heard Dave talk a little bit about them, but I think that there will be new places for practice by pharmacists. We will be doing individualized patient care. There'll be advances in drug delivery, and there will be enhanced medication safety. So we're already doing a great job in a lot of places. We're going to get a lot better. I'd like to add my thanks to the leaders of Medco for their vision and trust that they've placed in us. I'd also like to thank Dr. Adams, the leadership of FDU, for their guidance and trust and efforts to get us to this point. And I, too, would add my thanks to Dr. Mike Aveltroni, I don't know where anyone is in the room, and to Dr. Jeff Weinman for the work they did, for the other people at FDU, for the work that you put forward, and for the network of support that was built over the last 2 years. All of you are in this room, and I'd like to really give you a big round of applause. Thank you. So we get to the meat of this, and there are so many things that I love to talk about pharmacy education and the practice of pharmacy, but I know that you all want to get home before the next snowfall, so I'll be brief. At the Medco School of Pharmacy, we aim to be leaders in a revolution in healthcare, and we're going to start with the education of pharmacists. At colleges and universities all over the country, they offer the Doctor of Pharmacy degree. We're going to offer a curriculum for the Doctor of Pharmacy that plans for the future. We want to integrate technology. We want to use new platforms for education. The technology that we build in, we don't necessarily need to be tried and true. We want new technology. We want beta testing. Pharmacists are responsible for medication safety. So that's always been getting the right drug at the right place at the right time. It also includes making sure that we've talked to the patient, that we've educated them about their medications. So the pharmacist of the past is responsible for getting the right medication at the right place at the right time. The pharmacist of now and the future will be responsible for primary patient care. Will be responsible for ensuring access to therapies. We'll be individualizing drug therapies based on genetics. And we will improve the public health. As we look to the future, the pill or tablet, capsule, whatever you call it, as we know it, is going to go away. The future pharmacist is going to look back at those pills and tablets and say, that was an archaic method. How did we manage to use that? It was even very ineffective. I believe that the vision involved in the partnership for the students in this College of Pharmacy is that we will graduate students who will take us to the future, that they will be doing these kinds of things that we've all talked about this afternoon. Our vision for the future also suggests that the Doctor of Pharmacy degree won't be enough. It won't give the tools to the students that we need to lead this revolution. So we're in the process of getting approval for several different master's degrees. We already have a master's in business for FDU. Our pharmacy students will be able to choose that. We already have a master's in public policy. Our pharmacy students will be able to choose that. But we are creating master's degrees in health science where there will be concentrations in clinical research methods, concentrations in health regulatory affairs, concentrations in bioinformatics, the wave of the future, concentrations in medical health communications. Many degrees that our students will be able to add those specialty kinds of knowledge and take that with them as they practice and lead the revolution. The pharmacist of the future will be found in pharmaceutical industry, in clinics providing individualized patient care, in hospitals working as members of the leadership, ensuring access for patients, and making sure that medication safety is enhanced and practiced. We'll find them in our national, state, local governments. They'll be in software and technology companies, developing the software for education, developing software for education for patients, for high schools, getting students interested in science again. We'll find them in regulatory affairs divisions, and the list goes on. So, when the students from the first class of the Medco School of Pharmacy walk across the stage in 2016, they will have already begun to make an impact in the community, and they will be prepared for healthcare change and reform and to lead the future of pharmacy practice. They'll recognize the needs of the individual patient and not as a patient defined by their disease. And we want them leaving with an understanding that they have a responsibility to a global society. So thank you all for being here today. I'm really looking forward to getting to know all of you. I hope that you'll stay and join us for a celebration out in the Great Hall. And with that, I think we should go have fun. Thank you.